everyone. Today we are going to discuss about anxiety. Before beginning, I would like to frame the goals of this lesson. After watching this presentation, viewers will be able to explain the meaning and concept of anxiety, identify the causes of anxiety and the indicators of an anxious person, able to equip with suitable lifestyle changes to overcome or deal with anxiety issues effectively, and finally, value the importance of maintaining positive mental health. Anxiety refers to a sense of agitation or nervousness which is often focused on an upcoming potential danger. It is our body's natural response to stress. It's a feeling of fear or apprehension about what's to come. Imagine the first day of college, or going to attend a job interview, or giving a speech may cause most people to feel fearful and nervous. Anxiety is the mind and body's reaction to stressful, dangerous, or unfamiliar situations. It's a sense of uneasiness, distress one feels before a significant event. Anxiety significantly involves subjective perception of threat, physiological changes, and some kind of behavioral reactions. But unlike fear, it has no immediate threat. In my case, two of my neighbors have tested positive. Our house is just separated by 3 feet on the right side, and the other one on the back side is separated by 10 feet. I have my parents who are aged and 2 young children. Now I feel very anxious. My anxiety level is based on the projection of the threatening situation in the future. That is, will it affect us? Let me define anxiety. Like the term depression, the word anxiety and anxious are used in everyday speech. But what do mental health professionals and researchers mean when using this term? Or how can we define anxiety? David Barlow defines anxiety as a future-oriented mood state in which one is not ready or prepared to attempt to cope with upcoming negative events, and that it is a distinction between future and present danger which divides anxiety and fear. Anxiety is defined as apprehension over an anticipated problem. According to American Psychological Association, anxiety is an emotion characterized by feelings of tension, worry, thoughts, and physical changes like increased blood pressure. Psychologists focus on the anticipated aspect of anxiety. A person facing a bear experiences fear, whereas a college student concerned about the possibility of unemployment after graduation experiences anxiety. In positive psychology, anxiety is described as the mental state that results from a difficult challenge for which the subject has insufficient coping skills. Is it normal part of life to experience anxiety? Is the next question one might ask. We all feel afraid and anxious from time to time. Field observations have reflected the general perception time and again that a small degree of anxiety is instrumental to improve performance. Laboratory studies provide a classical example of U-shaped curve with performance. An absence of anxiety is a problem, a little anxiety is adaptive, and a lot of anxiety is determinantal. These adaptive feelings signal the presence of dangerous stimulus, leading to be more alert as it heightens our senses. For instance, if you are walking alone down a dark, quiet street late at night, you might be able to hear particularly well or be more sensitive to another person's presence behind or near you. Such heightened senses can be adaptive anxiety on a dark street. Similarly, a moderate level of anxiety before a test or presentation can enhance one's performance. Therefore, positive aspect of anxiety being it is adaptive will help us notice and plan for future threats, which is to increase our preparedness to help us to avoid potentially dangerous situations and to think through potential problems before they happen. However, if a person regularly feels disproportionate levels of anxiety that is persistent, seemingly uncomfortable, overwhelming, and if lasts for a longer period by interfering with one's life, it might become a medical disorder or commonly called as anxiety disorder. Let me illustrate a case study. Sunny is a 22-year-old student completing his 4th year in engineering school. The year had been a hard one, not only because of the long hours and academic challenges of engineering school, but also because of his father has developed serious medical complications. One day, while attending to his final year project work internship program, Sunny found himself feeling lightheaded and dizzy. During his one such regular presentation briefing along with his peer colleagues, Sunny became extremely worried about whether he would be able to answer the questions when his turn comes. As he thought about this, his heart began to pound and his palms began to sweat. Overwhelmed by a deep sense of fear that something was horribly wrong, he abruptly fled the room without explaining his position. Later in the day, his thought about how to explain leaving the room was so dominant but could not figure out how to describe the situation to his project's associates. That night he could not sleep, wondering what had happened and worrying about whether it would happen again, a clear sign of elevated levels of anxiety. He is deeply worried about how this would affect his ability not only to take part in presentation but also to perform well in other roles. 1 week later, while driving, he experienced a sudden attack of similar symptoms, which forced him to pull off to the side of the road. Over the next several weeks, he began to avoid public situations as much as possible because he feared being humiliated by the return of these symptoms. Despite his withdrawal, he experienced 2 more attacks, each in unexpected situations. He began to think that maybe project internship in the institute was poor choice for him because he had such deep fears about experiencing another attack during rounds. Sunny has clearly experienced some kind of anxiety attack which later became more persistent, leading to disorder stage. So what is anxiety attack? Anxiety attack is a feeling of overwhelming apprehension, worry, distress or fear. For many people, an anxiety attack builds slowly. It may worsen as a stressful event approaches. Anxiety attack can vary greatly and symptoms may differ among individuals. That's because the many symptoms of anxiety don't happen to everyone and they can change over time. Common symptoms of anxiety attack includes feeling faint or dizzy, shortness of breath, dry mouth, sweating, chills or hot flashes, apprehension and worry, restlessness, distress, feeling of fear, numbness, sleeplessness, shame, feeling isolation, shy, and etc. So, what is anxiety disorder? Anxiety disorder is a group of disorders, a type of psychiatric or mental health diagnosis, just as real and serious as physical disorders such as heart disease or diabetics. These are the most common and pervasive mental disorders in the 21st century. Psychiatric disorders that involve extreme fear or worry and includes generalized anxiety disorder, panic disorder, panic attack, agoraphobia, social anxiety disorder, separation anxiety, and specific phobias. Obsessive compulsive disorder and post-traumatic stress disorders are closely related to anxiety disorder, which some may experience at the same time as depression. These disorders alter how a person processes information and behave, which also causes physical symptoms. Mild anxiety might be vague and unsettling, while severe anxiety may seriously affect day-to-day living and classified under disorder. So let us focus on common causes, indicators and strategies of overcoming anxiety issues found in everyday life. Why should we discuss about this? Or how serious is this issue? To understand this, let me quote some research facts about anxiety. Everyone feels anxious from time to time. When anxious feelings don't go away and happens without any particular reason or make it hard to cope with daily life, it may be a sign of an anxiety condition. Anxiety is the most common mental health condition world over. In Australia, on an average, 1 in 4 people, that is 1 in 3 women and 1 in 5 men, experience anxiety at some stage in their life. Nearly 1/3 of adults in US grapple with one at some point in their lives, according to National Institute of Health. And the condition strikes more women than men. Their national prevalence data indicates that nearly 40 million people in the United States, which amount to 18%, experience an anxiety disorder in a given year. According to a review, approximately 8% of children and teenagers experience anxiety-related disorders, with most people developing symptoms before 21 years. Another study states that only about 1/3 of those suffering from an anxiety disorder receive treatment. These statistics are from developed countries. Just think about developing countries and underdeveloped countries. According to the World Health Organization, 1 in 13 globally suffers from anxiety. WHO reports that anxiety disorders are the most common mental disorders worldwide, with specific phobia, major depressive disorder, and social phobia being the most common anxiety disorders. In India, Economic Times, quoting research studies conducted in 2017, says that 197 million Indians, which accounts to 14.3% of the total population, are suffering from mental disorders, of whom 46 million had depression and 45 million anxiety-related disorders. So 14 means out of 100 crore, 14 crore people. So 130 means close to 20 crore people. Mental disorder cases increased from 2.5% in 1990 to 4.7% in 2017, which is doubled in less than 3 decades, of which anxiety and depression are the most common conditions. These alarming facts are serious concerns as directly related to mental health of population, with a huge chunk being youth. Moreover, we all experience this, but we are not trained to deal with it, being a major cause of concern. So, what causes anxiety? Anxiety manifests in different ways and are often diagnostically different. Researchers are not sure of the exact cause of anxiety, but it's like a combination of factors play a role. It is often accompanied by depression, and the two share an underlying genetic architecture. Beyond genetics, childhood experience such as early trauma or parental overprotection can play a role in forming an anxious disposition. The brain chemistry, which is influenced by the amygdala, a structure that detects danger, can become overactive, triggering a threat where none really exists. Apart from this, psychological factors like personality type, gender issues, stress and coping mechanisms, general philosophy of life has a huge bearing on anxiety among individuals. So, having gone through the causes, let us look into the signs and symptoms of anxiety. Knowing the difference between normal feeling of anxiety and anxiety disorder requiring medical attention can help a person identify and treat the condition. Ranjini was 14 when her boyfriend left her. Depressed, the Jaipur teenager tried to hang herself. Timely intervention by her mother saved her life. The distraught girl took a break from school and started therapy sessions. Now based in Delhi, she feels she can cope with the world around her, says a counselor. So timely intervention is crucial, as in most cases, being in anxious state will be reflected in behavioral change. Anxiety feelings differ depending on the person experiencing it. Feeling can range from butterflies in your stomach to a racing heart. You might feel out of control, on edge, like there's a disconnect between your mind and body. Other ways people experience anxiety include nightmares, panic attacks, and painful thoughts or memories that one can't control. One may have a general feeling of fear and worry, or may fear a specific place or event. So it is important to know the symptoms. So some of the common symptoms include feeling nervousness, having a sense of impending danger, panic, trouble concentrating or mind going blank, irritability, difficulty falling asleep, sleep disturbance, having difficulty controlling worry, having urge to avoid things that trigger anxiety are some of the causes. But anxiety is more than just a feeling. As a product of body's fight or flight response, anxiety also involves a wide range of physical symptoms including increased heart rate, rapid beating, shortness of breath, muscle tension, shaking or trembling, headaches, stomach upset, experiencing gastrointestinal problems, dizziness, feeling weak or tired, and so on. Furthermore, the anxiety and worry are associated with two or more of the symptoms and present for more days requires immediate attention. Here it is worth to note that these physical symptoms, anxiety sufferers often mistake their disorder for a medical illness. Additionally, your anxiety symptoms might be totally different from someone else. That's why it is important to know all the ways anxiety can present itself. Another aspect being the disturbance is not due to the direct physiological effect of the substance, example drug abuse, medication, or a general medical condition, example hyperthyroidism, and does not occur exclusively during a mood disorder or a psychotic disorder or a pervasive developmental disorder. Now let us look into how to deal with anxiety. Anxiety in children and teenagers are natural and common. In fact, studies show 1 in 8 children will experience anxiety. As children grow up and learn from their parents, friends, and caretakers, they typically develop the skills to calm themselves and cope with feelings of anxiety. As young Indians are grappling with anxiety, depression, and other mental health problems, it is important to suitably equip them. Simple natural strategies or remedies to manage anxiety on our own includes lifestyle changes. It can be an effective way to relieve some of the stresses and anxieties you may cope with every day. Most of the natural remedies consist of caring for your body, participating in healthy activities, and eliminating unhealthy ones. It can help young people who experience feelings of anxiety but who don't meet the clinical threshold for a diagnosis. Habits such as exercising, sleeping well, eating a healthy diet, stay active and working out, and limiting the amount of caffeine and alcohol consumed can be very helpful. Increasingly, research argues that mindfulness meditation is a successful technique as well. Taking deep breaths, observing one's thought without judgment, and acknowledging the limits of one's control can reduce feelings of tension. Identifying the circumstances that trigger one's anxiety and then pushing back against anxious or irrational thoughts can help to feel better prepared for the future. Positive psychology like optimism, building resilience can help children and youth. Awareness being the major factor, equipping them with proper and suitable information is key to help teens overcome anxiety. Developing suitable life skills like confidence building measures, problem solving abilities, critical thinking abilities will go a long way in helping children and teens face as well as overcome anxiety issues to a great extent. If we talk about the treatment measures, there are many ways to help manage anxiety, and the sooner people with anxiety get support, the more likely they are to recover. Anxiety treatment for children and youth includes cognitive behavioral therapy, that is talk therapy, and medications. On the whole, let me conclude by saying that the anxiety or physical symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. And so it is important to train or equip oneself to be aware and overcome anxiety issues in an effective manner. Thank you.